A 77-year-old male with newly diagnosed BRAFV600E mutated RAS wild-type MSS metastatic colorectal cancer has a history of significant peripheral neuropathy from prior non-cancer-related medication and an ECOG performance status of 1. He expresses concern about the potential side effects of intensive chemotherapy regimens. His oncologist is evaluating less intensive targeted therapy options. The EC Encorafenib Cetuximab, a lone arm of the BREAKWATER Trial, was stopped early due to significantly inferior efficacy compared to standard care in objective response. Answer: false. Enrollment in the EC group was closed based on the low likelihood of showing superiority over standard care after results from the Phase 2 Anchor study were published, not due to inferior objective response rate in BREAKWATER itself. EC therapy did lead to a numerically higher percentage of patients with an objective response, 45.6%, compared to standard care, 37.4%. In the BREAKWATER trial, the EC regimen demonstrated a median overall survival that was shorter than standard care. Answer: false. The EC group achieved a median overall survival of 19.5 months, which was numerically longer than the 15.1 months observed in the standard care group. The incidence of grade 3 or 4 adverse events was similar between the EC group and the EC plus mFOLFOX group in the BREAKWATER trial. Answer: false. Grade 3 or 4 adverse events occurred in 42.5% of patients who received EC, compared to 81.5% of those who received EC plus mFOLFOX. For a patient like this who may be unable to receive intensive chemotherapy, could first-line EC alone be considered a reasonable option based on the BREAKWATER trial discussion? Answer: yes. Clinical considerations suggest that first-line EC alone may be a reasonable option for patients unable to receive chemotherapy, despite its median overall survival appearing shorter than that of EC plus mFOLFOX. Did the BREAKWATER trials show that the median progression-free survival with EC alone was superior to standard care? Answer: no. The median progression-free survival in the EC group was 6.8 months, while in the standard care group it was 7.1 months. Was arthralgia a common adverse event, greater than or equal to 30%, in patients receiving EC alone in the BREAKWATER trial? Answer: yes. Arthralgia was the most frequent adverse event, occurring in greater than or equal to 30% of patients in any group in the EC group, affecting 34.6%. Compared to EC plus mFOLFOX, the median overall survival in the EC alone group in BREAKWATER was longer, shorter, equivalent. Answer: shorter. The median overall survival was 19.5 months in the EC group and 30.3 months in the EC plus mFOLFOX group. The percentage of patients experiencing serious adverse events in the EC alone arm of the BREAKWATER trial was approximately 10%, 30%, 50%. Answer: 30%. Serious adverse events during treatment occurred in 30.1% of patients who received EC. The primary reason for discontinuing the EC alone arm in the BREAKWATER trial was related to findings from which study? mCRC, Anchor, CMARC. Answer: Anchor. Enrollment in the EC group was closed based on the low likelihood of this combination therapy showing superiority over standard care after the results of the Phase 2 Anchor study of EC plus binimetinib were published. A 52-year-old female with BRAFV600E mutated metastatic colorectal cancer completed 6 months of first-line EC plus mFOLFOX with a good partial response. Her oncologist is discussing the expected duration of response and long-term survival outlook based on the BREAKWATER Trial findings, particularly the mechanisms underpinning the regimen's efficacy. The BREAKWATER Trial showed that responses to EC plus mFOLFOX were typically slow to develop, with a median time to response exceeding 6 months. Answer: false. The median time to response was 7.0 weeks in the EC plus mFOLFOX group, indicating rapid responses. The survival advantage with EC plus mFOLFOX observed in the BREAKWATER Trial was primarily driven by benefit in patients without liver metastasis. Answer: false. The benefits with regard to both progression-free survival and overall survival with EC plus mFOLFOX were observed across all pre-specified clinical subgroups, including patients with liver metastasis. The BEACON-CRC trial established Encorafenib Cetuximab as standard care for previously treated BRAFV600E mutated metastatic colorectal cancer. Answer: true. Based on the results of the BEACON-CRC trial, Encorafenib Cetuximab was established as the standard care for previously treated BRAFV600E mutated metastatic colorectal cancer. Does the addition of cetuximab to Encorafenib aim to counteract a known resistance mechanism involving EGFR pathway upregulation? Answer: yes. In colorectal cancer, BRAF inhibition alone can cause BRAF pathway reactivation by EGFR, and simultaneously targeting BRAF with EGFR inhibition is intended to overcome this mechanism. Was the median duration of response with EC plus mFOLFOX in the BREAKWATER Trial less than 1 year? Answer: no. The median duration of response in the EC plus mFOLFOX group was 14.9 months. Did the BREAKWATER Trial suggest that first-line treatment with EC plus mFOLFOX negatively impacts second progression-free survival compared to standard care followed by BRAF inhibitor-based therapy? Answer: no. The median second progression-free survival appeared prolonged with EC plus mFOLFOX 20.7 months compared to standard care 12.7 months, supporting the importance of first-line Encorafenib. The BREAKWATER Trial data suggests that the median overall survival with EC plus mFOLFOX in BRAFV600E mCRC approaches that seen in patients with RAS-mutated mCRC, BRAF wild-type mCRC, MSI-high mCRC. Answer: BRAF wild-type mCRC. The median overall survival in the EC group was 30.3 months, which is similar to the median overall survival reported among patients with BRAF wild-type metastatic colorectal cancer. What percentage of patients in the standard care arm of BREAKWATER who received subsequent systemic anti-cancer therapy went on to receive BRAF inhibitor-based therapies? About 20%? About 50%? About 70%? Answer: about 70%. Of the 139 patients in the standard care group who received any subsequent systemic anti-cancer therapy, 171.9% received BRAF inhibitor-based subsequent therapies. The BREAKWATER Trial's findings led to accelerated FDA approval of EC plus mFOLFOX for BRAFV600E mutated mCRC, including as second-line therapy, first-line therapy, adjuvant therapy. Answer: first-line therapy. This investigational combination therapy received accelerated approval by the Food and Drug Administration for BRAFV600E metastatic colorectal cancer, including as first-line therapy. Encorafenib is described as a highly selective, ATP-competitive small molecule inhibitor of EGFR, BRAF, MEK. Answer: BRAF. Encorafenib is a highly selective ATP-competitive BRAF inhibitor.